Hello, everyone. My name is Zachary Brooks from UGenome. We make genomic medicine personal and accessible for everyone. I'm really excited today to be able to have a conversation with Dr. Jaden Lee, who's the Chief Genomics Officer for UGenome. Great. So next question, Jaden, is how do we know if the drugs prescribed will work for me? This is obviously a big question, but let's say you randomly have to, on a Saturday morning, go to an ER to take care of something. And maybe there's an infection, so the doctor says you need to take a medication. You go to the pharmacist and you go home, take the medication. But how do we know that medication prescribed will work for you?
Yeah, so this is a great question. The obvious question is you will not know until you actually take it. Of course, as a provider, based on all the clinical information and demographic information, as I've discussed, you will take all these different clinical factors into consideration to choose the best medication that will most likely to work for you. So, physicians and the providers, and they try to choose the medication that will work for you based on evidence. However, you will not know that until you take it. So that's really, unfortunately, the only way to find out whether it works or not. But once again, we have different tools to find out which will most likely to work for you.
Okay, so it sounds like kind of going back to our pharmacogenomics, the response to medications conversations is that instead of always reacting, as an individual, as a system, and so forth, we can start to move towards the side of the spectrum where we're actually anticipating some of the problems that we might have, and then we can then get the medications that we need based on that. Is that how you would describe this, Jaden?
Exactly. And that's why I mentioned about the preemptive pharmacogenetic testing. So within the pharmacogenomic community, there is definitely a big push for preemptive testing. That way we can choose the right medication the first time. Because we are always trying to choose the best medication for our patient that will work. Pharmacogenomic will certainly help with that type of assessment to really choose the best medication for them. So, I still think that we are a little bit lagging behind when we're talking about preemptive testing. But I do think that, the future is really preemptive pharmacogenetic testing. So before you even start medication, we want to look at your genetic makeup and the differences to help us guide the right medication for you the first time you need it. So I do think that that is sort of the direction we are going forward.
Yeah, so very exciting. So the transplant community, organ transplant community, I know about pretty well. A lot of them pre-transplant and certainly post-transplant are taking a lot of medications, and knowing ahead of time not to take a medication would be a huge, huge help. So thank you, Jaden, for that.